Okay, welcome everyone. I've just given a presentation at the IPED symposium at Northumbria University, and I thought it's been quite a while since I put anything on this YouTube channel. So I thought I'd just recap the presentation here for all of you. So the topic is novel wellbeing and repair peptide use in the UK, and it's going to be netnographic findings based on forum data. And this is research that I've been doing along with Ev Hearn over at Liverpool John Moores University. So a bit of background on what we're discussing when I'm talking about novel wellbeing and repair peptides. Peptide hormones are one of the categories of drugs that have quite a long history in bodybuilding and powerlifting communities and so on. So human growth hormone, insulin, those peptides, those have been used for quite some time. So bodybuilders in the 80s, 90s, they were using those types of drugs. And more generally in society, collagen peptides are quite common. They're in a lot of beauty products, skin creams, and you can buy collagen fairly openly, legally from all manner of shops. So collagen for sort of well-being is also quite common, as were, not necessarily that common historically, growth hormone and things within the bodybuilding community, because until synthetic growth hormone became easily accessible, obviously there was a bit more risk and it was a bit more expensive, but came to be perhaps more prominent for strength and size gain. But around 2010-ish now, the exact date perhaps we could debate, but around that sort of time, there was this emergence of these research peptides on a lot of websites, and you would see all these different sites for research chems started to spring up around 2010-ish. And drugs like GHRP2 started to be used by these hardcore gym trainers, such as powerlifters and bodybuilders. And when I first started doing my PhD back in 2013, guys were talking about, oh, I've been trying these research chems, GHRP2, GHRP6. And alongside that, melanotan became this very mainstream peptide that was used a lot more broadly. And that was that same sort of period around 2010-ish that melanotan 2 started to take off. And that kind of took off because it's an aesthetics thing in the broader culture, and then these GHRPs and those types of peptides, those were being used more by the hardcore trainers. But this is like the emergence period of these novel peptides into kind of the more general culture. But as I said, the main ones that we're focusing on, they're ones that have kind of undergone this transition from, they were more associated with these hardcore powerlifters and so on, but increasingly are being discussed for their general well-being and repair properties. And that's these novel peptides like TB500, BPC157, and CJC1295. And there's some others like semirelin, and obviously I mentioned the GHRPs. And then just as a bit more context, obviously lipolytics, things like adipeptide and GLP-1 peptides, they're also becoming increasingly used, and particularly semaglutide. There's been a lot of discussion of that one a lot more recently, but we're primarily focusing on these ones more for general well-being and repair, like BPC and TB in this presentation. So a key thing that's happened more recently is this transition where there's been this increasing cultural awareness outside of these hardcore powerlifting bodybuilding communities. So they went from being these quite niche products, late 2000s, early 2010s, to suddenly towards the end of the 2010s and into the 2020s, suddenly they're a lot more available and they're a lot more openly discussed, and they're being used by people who aren't necessarily these hardcore trainers. So you can see I've got some examples on the slides there of, in the 2020s, the kind of attention that they're receiving. We've got More Plates, More Dates. Obviously has 2 million subscribers on YouTube now, almost. Has a lot of followers on Instagram. He's openly discussing some of these peptides, how to use BPC157, TB500, talking about how they can be used for injury recovery. We've got an example of Men's Health. So that's a completely mainstream fitness magazine, and that's talking about what you need to know before trying peptides for muscle gain and recovery. So peptides are so ingrained within mainstream gym culture nowadays that actually places like Men's Health are just openly talking about them. And of course, you've also got figures like Joe Rogan. Joe Rogan has talked in depth about his TRT in the past. More recently, he's talked about using peptides alongside his TRT on podcasts and the sort of well-being, general well-being effects that you get from things like BPC 157. Now, in terms of the availability going along with this growing cultural awareness, if you think of drug normalization, some of the main things we're looking at are the cultural acceptance of drugs, but also accessibility, availability. So Nick and we did some research that I made a video for this channel about that research, which was looking into the accessibility of novel peptides on mainstream e-commerce websites. And we looked at Amazon UK, eBay, and Alibaba. And what we found was that Amazon, there were over 60 different injectable peptide products that were available just from the three main sellers. And then there were some smaller scale resellers as well. And as you can see on the slide there, I've got an example image. That's just a screenshot from Amazon Mobile. BPC 157, 5 milligrams, 200 plus people bought that in the month prior to the screenshot. As you can see from the date there, that was taken in October, and it had 44 reviews at the time. And you can see some other things on there, such as saying not for human consumption, because of course these are not controlled under the Misuse of Drugs Act. They are not scheduled drugs. So they're technically not illegal to sell on the grounds of being drugs, but you can't sell them as a supplement or medicine because they're not regulated by the MHRA. So of course they're sold as these research chemicals, similar to novel psychoactive substances prior to the 2016 Psychoactive Substances Act. So we found those injectable ones on Amazon. We also found a lot of oral and nasal form peptides being advertised as well. And we were discussing whether this kind of normalizes the use of peptides more broadly. Things like hydropharm unbreakable, that's an oral BPC 157, or at least supposedly, we haven't quantitatively tested it, but does that kind of normalize peptide use, and then that kind of encourages people more towards the injectable ones, which are seen as, and for good reason, the sort of more effective ones to use. And of course, in that research, we naturally discovered Alibaba appeared to be the main wholesale supply site where people were accessing. They were getting in contact with these Chinese labs that were advertising on Alibaba, and then those were selling them to wholesalers here who would slap labels on them like Trident Peptide in this picture and then send them out. So that's kind of the background to peptides, this growing cultural awareness and this growing accessibility, availability of them. So in terms of this research, what we wanted to do was explore the use of these peptides, because as I said, there's been a bit of research looking at their prevalence in the market. There's been some research looking at hardcore powerlifters and bodybuilders, hardcore gym participants, and asking about their IPED use more broadly, which has included peptides. But outside of Milano-Chan 2, there's not been much that specifically just looked at what are the motivations and experiences of using these novel peptides. And Van Houten-Hearn is one of the few examples where they looked at women's use of CJC 1295, and they looked at things like anti-aging, wanting to have the sort of idealized sporting body as part of that, but also general everyday well-being, and some of those sorts of themes were coming through, and repair and recovery. So what we wanted to do with this research was essentially expand that away from women's use specifically and CJC 1295 and look at these class of well-being and repair peptides more broadly and how they are being used, what user motivations are now that these seem to be more accessible and they're not confined to these hardcore gym cultures necessarily. So what we did was an ethnography of UK fitness forums, and we looked at 493 unique threads and analysed a total of almost 15,000 posts. And that was through keyword searches around peptides, and then within that, the various ones that came up commonly, like BPC 157, GHRP, TB500, and so on and so forth. And there's some data on melanotan and semaglutide in there as well. But primarily we were focused on these sort of repair peptides, well-being peptides, more so than the ones generally attributed to like image-related stuff, even though we recorded some of that data. So within the study, we looked at these kind of two key themes that came up, and one was around motivations for using novel peptides, and the other was around the online folk pharmacology of forum spaces relating to the use of them. So, in terms of findings, what did we find? The first key area in relation to motivations for use was injury repair and rehabilitation. So I showed you that example of More Plates, More Dates, talking about injury recovery protocols, and this seems to be one of the main reasons people come onto forums and ask about peptides, is they've suffered some kind of injury and they're asking for advice on the use of peptides. And quite a lot of the discussions were relating to positive experiences of recovery, either after an injury or perhaps after surgery after having an injury, as in this example that I've got on the slide here. I used BPC and TB after a pectoral reattachment surgery. The physio was amazed how quick I was recovering. So it seems to have this enhancing effect, speeds up recovery, allows them to get through physiotherapy faster. And there were quite a lot of different posts and different responses which told a similar story of actually my recovery was really quick and doctors, physios were baffled by how quickly I was recovering. And this also reflects this emergence of a folk pharmacology around these two products specifically, that BPC 157 and TB 500 seem to be this emergent stack that would be recommended. So anytime someone would highlight having a specific injury, what is recommended, you would see forum posters saying that BPC 157 and TB 500 together is the way to address this. And what's interesting about that is the forum actually had a specific bodybuilding section. So although the forum was quite a general one, and we deliberately sampled a forum that wasn't bodybuilding or steroids specific, but that included like runners, tennis players, Brazilian jiu-jitsu guys, it involved quite a range of people, specifically to look at this kind of mainstreaming on the well-being side of peptide use. But it did have a bodybuilding section, and what's interesting is the bodybuilders kind of had this historic norm of using human growth hormone for injury repair. And what seemed to be happening was now with this, how accessible these novel peptides were, actually this was being replaced and people were commenting things such as this quote from the slide. Growth hormone for repair of acute trauma is minimally effective. BPC and TB are far more effective, assuming other factors key to recovery are already in place. So it shows how there was this evolving ethnopharmacology in these forum spaces that actually even the bodybuilders, now they were being exposed to these discussions from these other groups like runners, and with the growing accessibility of these peptides, that actually it was changing their understanding of the best approach for dealing with injuries. Although, of course, there was still discussion of those other drugs, and particularly steroids, which can be used, such as boldenone, undecyanate, oxandrolone, that sort of thing, decadurabolin, all used for injuries as well. But as I said, bodybuilders weren't necessarily a main focus here, even though a lot of interesting data came from bodybuilders, because they're these sort of historic, more experienced users of enhancement drugs. Actually, a lot of the discussions came from people like runners, as I've shown on the slide here, that a lot of the discussion was around everyday well-being and niggling pains and aches. So there was these top two quotes are from a thread asking about experiences using BPC 157 to deal with everyday strains. And someone says, definitely helped, got rid of nagging tendonitis in the left elbow I've had for years. And another is talking about sciatica, says they had this nerve pain issue and it worked really well for that. So it shows this expansion to these broader cultures where it's not all focused on bodybuilding, it's not focused on gaining size as perhaps early use of the GHRP peptides were, and now it's shifting more to this kind of everyday well-being, treatment of injuries, speeding up recovery, better energy levels, that sort of thing. But what is important is this kind of sharing of expert advice with less informed individuals posting on the forum. So you would often get more experienced posters which sort of post warnings or cautions for those who were perhaps less experienced, had less of an idea. And so this example from an individual who says, these peptides aren't without risk, and I wouldn't be taking them for everyday joint aches. Instead, find what's causing the problem and fix it. And there were a few other people in the thread sort of advising, for everyday joint aches, use collagen peptides, don't use TB500 and BPC157, because although we have these anecdotes, we have this good anecdotal data that it does have this positive effect on speeding up injury recovery, obviously we don't know the long-term harms of these because they're still somewhat experimental in terms of being used on a larger scale. We don't have that kind of long-term data for it. So be careful with overusing them for things that you don't really need them for. So that idea of kind of expert users or more informed users, those who have been using drugs for perhaps longer, like bodybuilders, being able to advise others. Now, anti-aging, perhaps unsurprisingly, was a really big theme. Obviously, anti-aging is something that's discussed a lot in IPED research recently, particularly TRT has been massive. A lot of discussion around the increasing prevalence of testosterone replacement therapy, both through prescription services and the promotion of those, as well as, of course, black market supplementation with testosterone to address some of the things that come with aging and the reduction of natural levels. And what we found was that this is very much reflected in peptide discussions, that actually a lot of older men who wanted to return to gym training, either for aesthetic reasons or for kind of feeling good about themselves, everyday well-being, and often a bit of both. They were interested in accessing peptides because they were aware, now they were a bit older, they might be into their 40s, they needed something to kind of enhance their recovery. They knew they couldn't train as hard as younger men and that their recovery wouldn't be as good. So in this quote, this guy says, I'm 39, I used to lift heavy weights, but I was injured, took a long time off. I've been training on and off, but my recovery isn't what it was. So he was asking about which peptides he should be using to help improve his recovery and make him feel good in the gym for that kind of self-improvement and anti-aging that comes with training in the gym. Now, an interesting finding in relation to this was this individual who discussed having been a bodybuilder back in the day and had previously used steroids as a bodybuilder in his 20s, and now he was older, he was coming back to the gym, and he said actually as he was older his perspective on peptides had changed. So he says, I've always been wary of GH-related peptides and secretagogues, but the older I'm getting, the less I care. It's probably less harmful than some of the other stuff I've done with my body over the years. So this shows why it's important to actually look at older men's motivations and experiences, and of course older women, but look at those who are older and are coming into using these drugs as kind of a distinct group, that their motivations might shift, and older men might have sort of different underpinnings, different desires, and different understandings of risk to younger men who want to use enhancement drugs. Now, in my research on well-being and therapeutic IPED use more broadly, that I published a couple of years ago, I spoke to people using black market TRT, using growth hormone to address chronic conditions that were causing them a lot of pain. And the recurring theme throughout that was this perception that healthcare providers were acting as barriers to good health. They didn't want to hear it. You go to your doctor, you say you think you need TRT, they say, oh, your levels are normal, but they don't show you the numbers, and they just kind of dismiss you. And that was encouraging black market, in that case, testosterone use, but some others with growth hormone and so on. Now, in this research, we saw a very similar thing where there was a lot of discussion because it was a UK-based forum. It was about the NHS, and there was a lot of discussion. Oh, if I go to, I've been to a physio and they weren't any good. They didn't seem to want to help me. So I'm looking for something to help with injury repair whilst I'm doing some exercise I found online. And similarly with anti-aging, we also found this. So this example on the slide, I think, is a really clear one. I'm on TRT through the NHS, and their protocol is 250 milligrams once every 4 weeks. I have no energy whatsoever, but they can't give more. I'm looking for alternatives to try to get a normal life. I was looking into peptides such as MOTSC or BPC 157. Just want to have more energy during the day. 56-year-old, £200. Any ideas appreciated. So obviously this is an older man. Testosterone levels have decreased. He's tried to get TRT. He has in fact successfully got TRT, but the NHS protocol is about half what it would be if you went to a private clinic, and they're saying they can't give him any more, even though he still has low energy, still has no motivation, no energy at all during the day. They still can't give him any more than 250 milligrams every 4 weeks. So in this thread, what happened was some people were advising him on peptides, saying, yes, BPC 157 is good, telling him which peptides would be the best for energy levels and feeling good and anti-aging, more so than anything else. But some people were also saying, get some money, go to a private clinic, because a private clinic will give you double what the NHS is giving you. That TRT dose is just far too low for kind of what our expectations are in terms of anti-aging and well-being in older age. Now, you could tie that to the literature more broadly around kind of this idea that we always have to have optimal health, and that in terms of aging, we must be expected somewhat to counter the natural forces of aging. But nonetheless, it does show that this kind of dismissal from healthcare providers of, well, that's the protocol, we can't give any more, even though you have no energy, even though you still have symptoms. That was the sort of thing that pushed people onto black market steroid use in my prior research, and it does seem to be underpinning black market access to peptides in the present research. Now, in terms of this idea of folk pharmacology on the forums, forums are obviously spaces that bring together a lot of people who have experiences of these drugs, and it leads to a kind of folk pharmacology around how to use them, what best approaches are. And as we said with the injury repair, how that came down to an understanding of BPC 157 and TB 500 used in conjunction. That was being recommended throughout the forum, and that was based on some more expert users posting academic research saying this is why we think those work well together, and also people who had used the drugs being able to offer their lived experiences of having used them. So what would often happen on the forum as a result is people would come and they would ask for experiences of having used a particular peptide, as in this example here. I'm looking into CJC1295 DAC. I've seen reviews, blah, blah, blah. I'd rather hear it from someone who's actually used it and experienced it. So this desire for this lived experience that actually, if people can tell me what their experiences were, what they felt when using it, that's going to be far more valuable than me just going off some review or some write-up that I've seen. And as well as this, it also, the forum facilitated this sharing of information around, what dosage should you be using, how often should you be injecting per day. If I have to use however many 700 micrograms of this peptide in a day, what is the correct spacing for the injections? Do I inject it 3 times a day? In what dose? Do I have to eat around it? So all this kind of information would be shared, as well as some more basic harm reduction information, because of course a lot of the people coming to use peptides, particularly if they were like runners or breakdancers or something like that, didn't necessarily come from a background of being an injecting drug user. So they were asking questions that the bodybuilders and the powerlifters and the hardcore gym trainers could answer fairly easily about sort of simple harm reduction. So where do I inject, for example? Do I have to inject this subcutaneous? Does it have to go on the injury, or can it just be anywhere subcutaneous? And also about things like preloading syringes. So can I reconstitute all my peptides, put them in insulin syringes, and store all my syringes in the fridge, as in this example I have on the slide? And you can see the response to that was, I wouldn't advise preloading the syringes, only because I'd be worried about bacteria formation. So just that kind of basic harm reduction information being shared, as well as that more technical knowledge and those lived experiences. Now, in terms of community harm reduction, perhaps the biggest thing we noted was the community discouraging unnecessary use. So people who were asking about the drugs for a reason it was perceived it wasn't really necessary, they were just looking for a quick fix. actually there was pushback against that. So in this top quote I've got here, this individual said he had just started training at the gym and he had been getting this bad wrist pain from lifting, and he was saying, oh, should I do TB 500 and BPC 157 to address this, coming on the forum to ask about these peptides. And he was met with people, roasting him, essentially saying, megadosing TB 500 and BPC 157 for a little wrist pain. Fix your form or use wrist wraps. Like, don't look for the drugs as a shortcut to training properly. Make sure you fix your form. And someone else in that thread was joking about, oh, he's only missing out on the methyl trend. So there was a lot of sort of banter as a means of regulating, controlling. Hey, actually, you shouldn't be using if you don't have this much knowledge. And that has parallels to what we saw with some of the steroid research, that people who seem to just want a shortcut didn't have a clear idea of how to train properly, what proper training routine, diet routine looked like. They were often very criticized by the more experienced steroid users on forums. So a similar thing happening in relation to peptides on this forum. But it could be more basic. It didn't necessarily have to be kind of that top example of the person being mocked for it. It could just be like genuine advice on, hey, you don't need to use this. So this individual talking about how much weight he had gained and whether he should use something to help him get the weight off, got this reply: you know the behaviors which caused you to gain weight during the time you were recovering from your injury, fix them and you'll probably lose the weight. So there's kind of advice against, don't just see these as a shortcut. Make sure you're training properly and dieting properly. And they're an aid on top of that. Now, tying in with this idea of shortcuts, there's also this issue of peptides perhaps being perceived as miracle cures or overemphasized by some people. So quite a few posters, like a significant minority of posters who said they'd used them, complained that they didn't have an effect, as in this comment here on the slide. Tried BPC for tennis and golfer's elbow, did absolutely nothing. So obviously there were some concerns about product quality that I'm going to talk about on the next slide. And there's also the possibility of like degradation, particularly with the nasal peptides that are pre-mixed. Peptides need to be kept refrigerated, maybe they degraded. But actually, quite a few of these posts seem to be linked to just false expectations of how effective peptides are, that people just thought, I'll take it and I'll be essentially magically cured. One really stark example was a marathon runner who had torn his groin and was complaining that he used peptides and they didn't heal him. But he was still doing marathon training. He hadn't had any time off to rest. And obviously, you still need to take rest. They're not these miracle cures. So as this poster says, if you want to recover, you need to rest. Peptides like TB and BPC may encourage healing and reduce recovery time by a significant but not miraculous amount, say 25%, but only if all other factors to aid recovery, i.e. rest, are in place. So perhaps people have been consuming messages around peptides on social media that are kind of bigging them up, promoting them as, and this will help you heal and recover from injuries. And of course, they're not miracle cures. They're just something that can aid in that recovery, but you have to prioritize rest. So again, coming back to that idea of those who don't know how to train need to be told by these kind of more informed, experienced users. But of course, product quality is also quite important, because that is an area which could affect the effectiveness of peptides as well, and potentially result in harms. So something that happened quite frequently on the forum was if a seller was identified as selling something that was deemed to perhaps be a poor quality product, it would immediately be flagged, and anybody asking about that seller would be directed to that thread warning about it. So in this example, you can see this individual saying, it's worse than scamming. The peptides I bought, when they mixed and left in the fridge, went to like a gluey type sludge. So a real worry that this is actually quite a harmful product that's being sold. And there was discussion about there's been such an explosion in the market and so many of these resellers offering stuff that actually, how do we know the quality? And one individual talking about GLP-1 peptides, so things like semaglutide, said he worked in a PhD chemistry lab and they had tested some of them in there and found the amino acids were in completely the wrong order for what was expected. So obviously there's potential for real harms from some of these, as in the case of the people hospitalised for the fake semaglutide last year in the UK. So again, with broader peptides, I don't know how much of it has been actively harmful substitution versus just bunk product. It seems to be more the GLP-1s is where we're seeing the more harmful substitution. But still, interesting how the forum kind of delivered this advice on product quality, harm reduction information. What's also interesting is that because of the way not everybody who accessed the forum, not everyone asking about peptides, had this experience in hardcore gym cultures, they often didn't know how supply chains worked. You ask a hardcore bodybuilder or powerlifter where their drugs come from, they're probably going to tell you from China. But a lot of people who have just seen kind of promotion material for peptides and then want to ask about them don't necessarily know this. So this individual was asking about melanotan 2, and he was asking about this place that said it was UK Pharma because he said he didn't trust the Chinese-made stuff. And he got a reply saying, for fuck's sake, you reckon it's being made by a UK pharmaceutical giant and repackaged by this reseller? It'll be the same as a Chinese generic because it is one. So harm reduction information, just making clear to people, no, all of this stuff is this Chinese generic lab stuff, and it doesn't matter if there's UK Pharma on it. That's just the reseller's branding. It's the same stuff. So that acting as kind of common sense knowledge to hardcore powerlifters, but not necessarily known to a lot of the people who now their peptides are more seen as these kind of well-being supplements, don't necessarily know this. And particularly in that case, that was melanotan that specific response related to, which of course is a much more mainstream peptide. So in terms of key takeaways from the research, obviously we found that forums act as these hubs of knowledge exchange for these experimental compounds, that there isn't necessarily this ingrained understanding or this long-term research on them. So what happens is there's this combination of users with this lived experience of using these drugs interact with other users, interact with some of the more expert types who are sharing academic publications and so on, and this leads to the development of this folk pharmacology around the best ways to use, what safe ways to use would be. We found motivations were mainly encouraged by they were repair and recovery, anti-aging, and particularly among older men returning to the gym, and general well-being. So not so much prevalence of GHRPs being used for strength and size that we saw when they were kind of emerging in 2010. Actually, those were now more well-being, and people who wanted size and strength, they're taking steroids and growth hormone. So novel peptides very much within this well-being and repair category now. And as with my prior research, talking about healthcare providers, obviously that seemed to be one of those big underpinning factors is perceptions that the healthcare system just doesn't care. You're injured, they give you a physio who isn't much good, they don't want to help you further than that. You have no energy, okay, well, our TRT dose is this, we can't increase that at all. And that, of course, motivates people to use black market products. So more understanding needed from healthcare practitioners if they want to address black market use, or in this case, grey market use of novel peptides, since, again, they're not controlled under the Misuse of Drugs Act, hence you can buy them on Amazon, even if they say not for human consumption. So in terms of next steps, my kind of initial ideas on what we need to do next, forums obviously attract a specific type of user. They attract the people who want to be more informed, who want to do more in-depth research. So perhaps we need to look at what discussions are happening on things like social media apps to get a broader understanding. If these are so accessible now, they're so mainstream, what's being said about them on these other platforms where there isn't that level of expectation on being educated that you perhaps get on forums. Semaglutide, I've mentioned we saw some posts about GLP-1 peptides, but since I did the data collection, semaglutide has just really blown up as this massive thing the past couple of years. So I think more specific research into the use of that peptide, more of a lipolytic, of course, needs to be done to kind of understand, again, motivations, what user experiences are, and some of the potential harms and harm reduction strategies in relation to it. And then actually directly interviewing wellbeing peptide users, engaging with them and seeing, well, what do they want to see? Because particularly this stuff about healthcare providers, I think really does evidence that there is this kind of perception of we're not being heard that we've previously seen for steroid users. So I think that could be an interesting next step. So that's the research at present. We are submitting an article on it this week, so we'll see what it looks like after peer review.